Yeah. There you go. There you go. Thank you. All right. Good morning. Everyone got food? Everyone has a drink? Okay. So let me just start by saying I'm not here to hurt anyone's feelings. If I say anything that feels socially awkward to somebody, just raise your hand. I will manipulate my vernacular so I'm staying appropriate for everybody because I do generalize some of my philosophies and terms and cultural kind of norms and things of that nature. I work as a brain and behavioral health clinician. Has anyone ever heard of Dr. Daniel Amen? Yeah, so Amen is, we work together. I have my services built into his system of care, which is all neuroscience. We do functional brain treatment. And I travel all over the country with patients, anywhere from entertainer celebrities down to nonverbal autistic kids who are highly aggressive at my center, which is right off of Route 70 in Southampton. I function as a school social worker, but I'm not running in and out of schools like when I was in my 20s counseling kids. I actually built infrastructure to schools, so I redesigned them so districts can maintain more kids in their districts, or number two, so we can afford more interventions that are practical to sustain kids with meaningful interventions that can get them better, even though schools are not clinics. And then the last thing is that I used to work as an advocate, but my advocacy is really educational. Anyone that comes to me and they need an advocate, I send them to Advo-Kids, Dan Pastrnak's group. But I educate the world. So, someone was just laughing last night because my intake in my office can last 4 hours. And someone said to me, what do you talk to a client for? For 4 hours? I said our counseling visits minimum are like 2 hours. So when I'm at work, like tomorrow, Saturday, we'll go from 8 o'clock in the morning to 3 o'clock in the afternoon. We'll even have groups, but it'll be anything from pro athletes all the way down to kids who had brain tumors removed, who are using prosthetic devices, who have neuromuscular disease, leaky gut syndrome. So we're really big on the gut. But if I'm training somebody to get better, the goal is to teach them how to work independently. And you can't do it in an hour. It's just impossible. So I wrote a book called Coping and Accountability for Classroom and School-Wide Management. It was a manual, and it just went like viral. So, I had it in tons of schools, and I'm just going to give a prop because I just rebuilt Cape May County for Special Services School District down at Cape May County, who deserves a ton of credit for allowing me to lead the changes that we built in their school. But the efficacy behind everything that is going on in that school right now is so phenomenally awesome. So I've recommended public schools to go in and see how we get things done because of the type of leadership, communication, infrastructural design, things of that nature, homogeneously grouping people so you don't have kids being traumatized by other kids who are acting out, things of that nature. Unfortunately, if you study the idea of education in other places, like I studied Finland's education, which is the top in the world, they don't have all these special education services. They don't even have special private schools. It doesn't exist because they differentiate their model so much so that every kid's design of how they interpret information and how they can perform on that information, retrieve it, process it, is all accounted for, built into those classrooms. It's fascinating. And then I love the accountability side. I studied in Jamaica, their educational system. I remember it was 110 degrees in this room. I was sweating to death. And I said to the lady, while every kid had long sleeve shirts buttoned up, no one sweating, which I get if you're used to the climate. But I said, excuse me, don't the kids complain that it's 110 degrees? She goes, oh, they would never do that. And I thought, wow. But meanwhile, I see how kids are, trying to sustain or manage in our culture in New Jersey, and it's outrageous. So my goal is taking those who have special needs, whether I work with a ton of doctors, lawyers, hotshot athletes, people who are making money, who are successful, to those who are disadvantaged and not able to access any resources, nor do they know how to, even if they had the money. And our goal is to make them, keyword, independent. Bottom line is independent. So I hope everyone understands that you have two brains. You have your brain that's in your skull, and your gut is a brain. And 75% of what's manufactured in your stomach goes to your brain. Does everyone know those rules of thumb? Those are important because right off the top, sleep, diet, and exercise are your three drivers for performance. So any patient client that I have, we always focus on sleep first, Anyone who doesn't get great sleep, doesn't get a release and a replenishment of blood flow in the brain. They do not get rid of the toxins that are in the brain, which means that you could demonstrate symptomatology the next day that looks like you have schizophrenia, attention deficit disorder, anxiety disorder, just by having too much toxicity in your brain. So we want, in our world, we want things to be measurable. Measurable is important, and everyone got the handout, but it becomes important because how do you really know if you're getting better if you don't have measurements? Now, I'm not talking about 16-page plans that have 15 pages of recommendations for teachers to follow. It's not working for anybody. We're talking about having a starting point and looking to see whatever we're doing and if it's really having any impact, or we call a meaningful experience for the people that we're trying to care for. In doing that, I use some of the ABA, Applied Behavioral Analysis. Everyone in this day and age knows ABA because it's the hot thing as an intervention for people with, particularly with developmental or behavioral challenges. But if you look at your handout, you will see the 5 functions of behavior. And I always start with the 5 functions of behavior, and we don't have to go through it in great detail because my goal is to teach you how to develop skills with people so they can be held accountable. But I'm going to walk through those 5 functions because within those functions, people are tripped up every day trying to figure out keywords. Ready? Is it a disability or is it a disciplinary problem? So my center is a treatment-resistant center. We get people that have averaged at least 3 hospital visits. They've been on at least 6 medications. They've seen at least 4 or 5 doctors, and the treatment hasn't prevailed, hasn't worked. The theory in functional brain treatment is that psychiatry is the only medical profession in our country where the doctor doesn't investigate the organ that they treat. So our goal is to go in and investigate so we can figure out what's going on. So not everyone even has the resources to be able to afford that. So not everyone's going to get that level of care. So it still deserves what we call functional investigation. So before I go any further, this morning I was with a teenage girl who has a really significant seizure disorder. And what I was doing at a local school district here was meeting with the staff, showing them how we're building skills with this girl who's on the autistic spectrum and how we're developing the skills of getting her to identify what's wrong, how she feels, and what she needs, which she's now doing, which then takes training into her recognizing that she's going to have a seizure so that she can ask for help, which is starting to happen. And then lastly, how to prevent herself from being so stressed when she perceives things that are overwhelming to her that actually can activate a seizure. And it's working so well that I actually went to the school to celebrate with the staff because they're just following my education, my plan, but they deserve to be gratified. So here we're looking at reinforcement schedules and things for kids. The goal would be to reinforce the people who are making a difference in this kid's life so they stay motivated. So we want to celebrate that. So when you look at these functions, I want you to even think about yourself or your own children, about where these functions lie in your own infrastructure. So in here we have 5 functions of behavior. So in ABA, they talk about the 4 functions. I'm giving you a 5th, which is a part of the model that we have created in my science. But it's attention seeking, where the child engages in challenging behavior to gain attention for others. So in New Jersey school systems, we will see kids calling out, tapping, making noise. We have these one called bomb droppers. You'll have kids. And then you turn around to see who's doing it. Of course, everyone looks like they're paying attention. So then people start to get really upset because you can't find out which kid it is. But we already know that the kid is either seeking attention or he might have some sensory issues. So he's trying to stimulate his brain. Let's try another one. Avoidance. Trying to escape the situation. Or try to escape from other people. So we have the kids that constantly want to go to the bathroom, they go into the nurse, they have to go to their locker, they have to get out of their chair. Here's a big one. They put their heads down. So they're not, paying attention, or it looks like they're sleeping. So if I can't see you, then you won't call on me. But we look for the escape of the situation with those type of children. Third one is accessibility or tangibility. So they engage in challenging behaviors to gain access to high preference activities or tasks. So they want access to the computer, or they want to have access to something, a chair that feels comfortable. Or sometimes they want access to their friend that's out in the hallway, and they'll do anything to get out there to even get in trouble. So they have to be told to go down to the office, but they'll get to walk with their friend who they saw in the hallway. And then lastly, we have the sensory, where they engage in challenging behaviors to seek pleasure from sensory situations. And the autistic world is very big on this. But we do this all the time. Like when I go home, I don't sit on any random furniture. Everyone has that one piece of furniture that just feels right. And you seek that spot in the chair where your butt has made an imprint that just makes it feel okay. But we look for those things. Food, or I just said to Denver, I had the best glass of wine last night. I look for the taste, even the smell of that wine. It's all very sensory. It makes everything in my world feel that it's okay. Now you see pre-antecedent, what we call the precursor influence, an influence of behavior that's neuroanatomical, pathophysiological, or psychological in nature, which can be the cause of a maladaptive behavior or behavioral function. This could be another training. When I do trainings on this, they're no less than 8 hours typically, and I do tons of them for the state. I train hospitals and clinics like crazy. And this becomes a big one because I have a case right now. I'm just using this because this is the norm of a case in my world. So I have a young man who started feeling insomniac. He just wasn't sleeping and he didn't have any problems prior. So he's in his 20s. So his friend says to him, listen, why don't you go to a Lyme's doctor? I heard if you have Lyme's, you could develop some type of insomnia, symptoms. So the young man goes to a doctor. The doctor puts him on a prescription, tests him first and says, yes, you in fact have a certain types of Lyme's. But the medicine they put him on is kind of outdated. In 2012, they created a new understanding that this medicine wasn't the best, and it dropped his immune levels so low, he actually acquired 3 parasites. And we see this often with kids who have psychiatric symptoms that actually have gut issues to include mold, toxins, non-toxic metals, and parasites. Everyone in here right now has parasites in your system. That's how you function. But you don't need every type of parasite that's out there. So the parasites deserve a certain type of treatment. But the problem was the treatment was going to cause them to have psychotic symptoms because that's the side effect of the treatment for the parasites. So he starts the treatment for the parasites, and he's driving down the road, and he gets in a car accident. So the car accident, he hits his head. He has a severe concussion that we were able to see when we radioactive traced his brain, and we could see the impression of the concussion. So with him being concussed, he still wasn't stable, but the symptoms that were the side effect of the treatment for the parasites was prevailing. 5 days later, he gets in another car accident, and he's now thinking he's God. So he thought, even though I got in this car accident, I'm okay because I'm God. No, he's Jesus. I'm sorry. So because he thought he was Jesus, he knew that he was okay. So he actually believed he could walk in front of a car, and then the car would either go past him or around him, because in his grandiose mind, he's a very powerful human being right now. So when the police arrived and they saw him and he looked very disoriented, they immediately thought that he was under the influence. And because he was struggling with them and not making sense, they ended up physically beating him up. So he gets another brain injury, so an insult. He ends up in the hospital, but because he's hearing voices, immediately our system of care does what? They give him 2 antipsychotics. So any kind of antipsychotic that you take that you don't need is going to cause toxicity to your thalamus and your gut. We all know that now with today's science. So now he's on antipsychotics, which is interrupting and interfering with the treatment to get rid of the parasites. So now we're on suicide watch. That's my typical case. So we fixed that. Right now we're in really, really great shape. But you have to say to yourself, the second anyone goes to the hospital, as soon as we hear they're hearing voices, immediately, without investigating anything, we say, let's give them medication. I'm pro-medication. I'm all about that. But what is the precursor? The precursor is a medication to treat the parasites. And we knew it was coming. I wasn't involved in the case just until I got to the end of that story. But we have leveled the playing field. Now we're just getting rid of mold that exists. And the mold came from cats. They have a few cats in the house. And actually the mold came from the cats. So I had another girl that was reacting every time she was with her father. And the mom thought that there was a problem every time she had a visit with her father. Parents are divorced. So she kept taking the dad back to court saying, my daughter shouldn't be able to see my ex-husband because they don't get along and they break out into these tenuous fights. And meanwhile, the dad doesn't know any better, so he just buys her whatever feminine products she needs. Well, here she's allergic to aluminum, and what's one of the highest prevalent ingredients in women's deodorant? Aluminum. So every time she would put on the deodorant at the dad's house, the aluminum would flare up into a stress reaction, and they would argue over nonsense, things that didn't really exist. But the mom is from California, and she has organic feminine products. She doesn't have the same experience when she's at her mother's house. So when we talk about coping skills, Think about how beautiful it would be if all of our patients, children, or students that we work with were exquisite with their words and they could explain to you what's wrong, how they feel, and what do they need. So Daniel Amen created this great definition of trauma, which is what I specialize in, which is trauma is inescapable stress to the brain. Plain and simple. So if you have mercury poisoning and it's in your brain, it's inescapable. You can't get rid of it. Your parents fight every day and you can't get out of that house for yourself. You can't go find another family to move in with. It's inescapable. Most people think of trauma as got to be you were sexually abused, you were at the war. It's inescapable. So when we think about kids who are in inescapable situations, could you imagine if they could just share with you how they feel and then just tell you what it is that would help them recover in the moment or for the long term, that would be so powerful to be able to create some sort of change so they can live a fruitful life. But that's not what usually happens with our children, because the average brain doesn't cortically, which is the thinking part of your brain, mature to your age 25. So what happens? They act out how they feel without really telling you how they feel. So the behavioral specialists run around and they're measuring the behaviors. The psychologists saying they're insecure with their feelings. The psychiatrists are writing prescriptions. And meanwhile, there's a precursor to all this. There's really about, well, what's going on with this kid? Like, how much stress can a person really actually tolerate? You want to hear trauma? So I work with a lot of nonverbal kids, and we teach every one of them. Our given goal when they come to our center is teach them how to communicate. It could take 2 years, iPads, keeping them there. The average stay post their session is 6 hours of a kid who refuses to comply in my place by they ripping their clothes off, spitting on my floor, urinating on the wall, whatever they're expressing to show that I'm just not happy. But they can't express, they can't tell you. So that's why we work the longest and the most in teaching them how to communicate through iPads. So we don't let them leave until they hit the button that says, go home. Now, as soon as the kid walks in, what's the button that they're looking for? Go home. I say to the parents, take them home. He hit the button. Now, when they come in, we withhold the iPad until they follow at least one expectation. Then it's 2 expectations. Then it's 30 minutes expectations, 1 hour expectation. Through all that, we get this thing called an extinction burst, where they get worse before they'll comply. But it takes time. To get parents to follow through and follow suit with those extinction bursts is the $1 million ticket. Anyone that's ever been here, I know a couple people that are in here just seeing you, know in my center, it's on. Parents not allowed to leave. You're staying. You have plans, you're going to a wedding? Not today. You came here, you're waiting until we're ready to send your kid home, because we won't be doing this after 2 or 3 times, because your kid is going to learn this is how we get it done. But I always have to give credence. What about a kid who's autistic who can't speak and he can't tell you that he has a toothache? Or he has a hemorrhoidal problem and his backside is killing him, or he has diarrhea, or something in his belly, or his feelings are hurt, or the schedule changed, and he just wants to tell you, it's not what I was thinking we were going to be doing today, but that's not what they do. They go for your hair. They go for your face. They do these outrageous behaviors because when stress goes up, your cortisol levels go up and makes blood rush to your hands. Now think about coping skills. It's not about special ed kids anymore. Now we're talking police officers. So if every time you get stressed and your cortisol levels go up and it forces blood to rush to your hands and your feet, and you got a police officer pulls a car over on the side of the road, he's got his hand on his gun, it's 3 a.m, and he sees 4 people's heads in that car and there's no support, and he says, sir, put your hands on the dashboard, and the guy reaches for his wallet, what happens to his hand? He draws a gun. But if you already had the gun out and the guy reaches for the wallet, what happens? He pulls the trigger. So as much as everyone wants to say, the cop did this, the cop did that, how much training do police officers have in learning how to control the impulse that is delivered by their heart rate, which is influenced by their cortisol levels, which is the precursor is your body's perception of stress. So when we think about what kids need, we want them to be able to navigate on their own so they're in control and they know exactly how to access what it is that's going to help them through these stressful situations. That's become my whole world. And what I learned years and years ago was, this ain't about special ed kids. These are like doctors who have 30-hour shifts. These are nurses that only deal with crises and all they hear is bad news. How many people call a dentist to tell them how great their teeth look today? I mean, dentist gets a call, someone's complaining. Child study teams, loaded with paperwork. I can't tell you how many child study team people that I love who are so loaded with paperwork, and they're in violation of not seeing the kids that they're supposed to see on their caseload often enough, but they can't. So then they got to go home feeling guilty, but yet now they're in trouble administratively because they haven't seen the kid as per the IEP, but they're so busy. So everything is about coping. So what do we do? So, my model is, what's wrong? How do you feel? What do we need? So there's got to be another way. So if you go down to the Roman numeral 2, you'll see there's a 3-term contingency model. A plus B equals C. And this is not new science. This is all ABA stuff. So you don't have to be a board-certified behavioral analyst to do ABA. The entire world is wired as ABA. If you're driving home and you get pulled over and you get a ticket, that's ABA. There was a behavior, it was inappropriate, you got a consequence. You don't have to be a board-certified behavioral analyst. Now, if you want to put together a bunch of charts and analyze and understand the function and put together a schedule that can maybe increase appropriate behaviors and decrease negative behaviors, you still don't have to be a board-certified behavioral analyst, but you really have to understand behavior. But here's the key. You also can't spend so much time analyzing the behavior that you don't have a relationship with your client or your student or your son. And if you're working with the system of care, we go to their house and we do counseling. But going for a walk is fine. But we're not hired adult friends for children. What's wrong? How do you feel? What do you need? We have a responsibility to make sure that these people are coming out with tools. How do you hold people accountable if they don't have tools? If I own a company, how do I hold an employee accountable if I didn't train them? How do I hold an employee accountable if they don't have a job description? How do I hold them accountable if they don't know what the boundaries, limits, policies, procedures, and protocols are? How do I hold them accountable if I'm not consistent with my policies, procedures, and protocols, but yet I'm going to hold my employee accountable? If I keep changing my schedule around, how do I hold a client accountable when they can't predict what the schedule is? I mean, everyone's got to go back into, well, if we're going to hold someone accountable, they have to be pretty capable. Capable means you have to be skilled. So we look at these 3 factors: antecedent, behavior, consequence. So the antecedent, behavioral conditions or stimulus or changes that exist that occur prior to the behavior. So the teacher says, hey, we're going to take a test, and right away the kid gets anxious. So we'd say the antecedent was the announcement of the test, and then the behavior becomes whatever he is doing behaviorally, the manifestation of the behavior upon hearing that there's a test. So now Johnny decides, I can't do a test. No one told me there was going to be a test today, so he wants to escape. So if he's going to leave, I need to go to the nurse. I just don't feel well. What function of behavior is that's on A through E? Avoidance. Avoidance. Or another kid will put his head down. And meanwhile, he knows, well, the teacher can't touch me and lift my head up physically. So if I stay here, I'm okay. So sometimes as adults, we do things we don't even realize we're contributing to the problem. So Johnny finds there's a test. So you know what he does? As soon as he hears there's a test, he makes a funny joke in class and gets 5 people laughing. So now, if the educator's upset and the educator says, you know what, that's not funny, the fact that I'm even going to critique that on the spot versus having a boundary that's already in place, we call these procedures. And the kid already has a predictable outcome based on knowing if he committed that behavior, what the outcome's going to be procedurally, could be a disaster. Because if I say, you know what, you're going to keep making noise, you're out. So he acted out to get attention, but his real understanding to it was he wanted to escape. So now he goes down to the main office that's 1,000,000 yards away from his classroom. And when he gets down there, he loves the copying machine. I can't tell you how often this comes up in my world. So then the lady at the office says, listen, I'm going to have you running around my office tearing this place apart. Here's a whole stack of papers. Run these through the machine. So you might as well be busy while you're down here. Well, now he has accessibility, which is another function to what he likes to do. And he's thinking, this is great. I mean, I love it down here. So let me get this right. I yell out. I make everyone laugh. Someone gets frustrated and upset. They send me out. I come down here. I'm active and busy. I'm hands-on. And then when he's done, he gets to sit in this really comfortable Natuzzi chair that is so much better than that plastic chair that's in the classroom. So then he gets that last bit of sensory reward. So then we go back to, well, what was the antecedent precursor to that? Does he have a math disability? Here's one. Did he not sleep last night? We even go back and say, some kids stay with their dad. Parents are divorced. Every time he's with his dad, he's tired and he's late. He doesn't eat well. So he comes to school, he's disheveled, he's off task. So we look for things. Did he take his medicine? Does he need medicine? Does he even really need treatment? Does he have a substance abuse? Like, we have to go in and figure out what's going on, because our goal is to give him tools, because somewhere along the line, he's going to have to take a math test. He's going to have to take a math test. So what do we want him to do? Can you imagine if he came in and said, God, I'm just really tired. When I'm at my father's, I don't think I'm hitting all levels of REM sleep. So my sleep recovery is not great. And I know the toxicity is not leaving my brain. And we all know in your thalamus, if you have high levels of toxicity, we all know that raises your cortisol levels, because I'm going to be intolerant today and probably not be a good listener. But meanwhile, because he's aggravated and angry, we send him to the psychiatrist. They're going to say oppositional defiant disorder. And then they're going to say, well, ready? Here we go. This is my typical public school experience. Ready? And I work with tons of them. But these are the things I fix. And then they'll say, oh, he's oppositional defiant. And I'll say to the school, yeah, we don't want him diagnosed with that. Well, he is. I understand. But if he's diagnosed with that and his manifestation of behavior is he's oppositional defiant, we have to hold him accountable without suspending this kid, because he has a right to be in school and being educated, even though we're saying that he can't help it. Meanwhile, we're stranded. We're locked in and held hostage with a diagnosis for a kid that really needs tools. He just needs tools. So when you look at the behaviors can even be culturally driven. I have to say this to psychiatrists over and over and over. I train psychiatrists. I'm going to Italy and going to Rome in February, training neurologists, and it's all on this stuff. Yet, behavior is behavior. It doesn't always have to be a diagnosis. I grew up, my mother's Italian, talks with her hands. And my friends would come over to my house saying, why are your parents always yelling at each other? I'm like, I would say, hey, yelling is how we talk in our house. I never understood it. Like, what do you mean? Dad looks like he's going to smack her. And I'm like, what do you mean? I never knew what that meant. Yeah, every time I come over, your mom's making me eat all this food. Well, you're going to have to eat. I mean, you asked to eat over, and you're going to have to go through the whole course. And if you don't, you're going to make her upset. Then you're going to feel guilty because she's going to want to beat you. I mean, it's, this. But is that diagnosable behavior, or are they cultural norms? Here was a common one. Hey, man, can I eat at your house tonight? Absolutely. Meanwhile, we grew up poor, but we always had pasta because it's cheap. All right, will your mom be cool with that? Absolutely. You don't have to ask. I mean, my mom. But is she going to hug me for like an hour before I, go into the house? Do you want to eat over? You don't want to eat over. So does she have a hugging disorder? You have to say to yourself, the norms of behavior are societal driven, right? The norms of behavior in Pemberton are much different than Cherry Hill. They're just different. I work in Manhattan. Watch the driving in Manhattan compared to being on the turnpike. When I'm on the Bell Parkway in Brooklyn and I hit my horn, we duck and move. No one even looks at each other. I'm like, that was badass. Like, I'm just feeling like a race car driver, and I'm going to make it to work on time. If I did the same beep, ready? The guy pulls up alongside. Is there a problem? Now he's going to follow me to my house and fight me in my driveway because I offended him. And they're only 13 miles apart. But it's a cultural difference. We have to say, what are we diagnosing? And what's the diagnosis for? Recovery. What's the best way to teach kids how to recover? To understand their own function of their behavior. And if they don't understand it, they act out, and we do things wrong all the time. We just approach them all these ways that just doesn't make sense. So we go to the last one, which is the dreaded consequence. For the record, I have to explain this to everybody. A consequence is not a punishment. Does everyone follow that? A consequence is an outcome. There are positive consequences that are negative consequences. I tell parents all the time, natural and logical consequences is the answer to people being responsible in life. Punishments are not always the answer. Consequences. Like, remember when we were kids, I'm in my 50s, you couldn't get me in the house, but when my dad would look at me and give me that look, gentlemen, I have to go. Like, the look was an if and then. If I don't get in the house now, then hell will be paid. And my dad was very good about this. Thank you for coming in because we need to eat dinner, that kind of thing. And I appreciate that now. But back then, I thought he was interfering with my day. But then I look at today's kids. You can't get them to leave the house. And we're bribing them. Come on, I'm going to get you more time on your cell phone that $9,000 cell phone after I buy you a $7 cup of coffee at Starbucks if you just go outside and get air and sunlight? It's crazy, right? What the heck has happened to us? It's amazing. It's amazing. They hold us hostage. Today's parenting model is the kid is entitled to the cell phone, but then I have to find a way to take it without traumatizing him if he no longer deserves it. And the answer to that is he doesn't deserve a cell phone. He doesn't deserve it. It's not a right. It's a privilege. What did we do before we had cell phones? If he's in school all day, what do? You call the school. Can you get my son on the phone? I'm just using this as an example. But we want kids feeling the value of meeting expectations, of just having social etiquette, of being proper and polite, waiting their turn. So when we look at consequences, people who are very negative consequence driven, find themselves losing track of the process of really what you're trying to achieve as a goal. They become very outcome oriented. So if I have a lot of patients who are heavy because of the medicine they're on. And in my center, 50% of people that come in on medication, we are actually successful in just putting them on supplements, not having them on medication at all. But we're also lab testing them in my center to know what those supplements are, because I want them to understand how the supplements work. So the supplements then become part of their natural regimen. So when I say to them, but you have to eat these foods because this is what you need, and they'll say, but I don't really care for that. But you don't have to care for it. It's what your body deserves. We're in the world of, what have you done for me lately? And I really don't want to do that because that's not what I want. What you want and what you need are two different measures. Kids will commonly fight for what they want to avoid what they need. Restful sleep is one of the things they really need. And kids will argue and fight where parents will give them the attention, ready? In the moment about getting to bed and being asleep while the child is still avoiding being in bed and being asleep. It's amazing when you think about how dysfunctional that really is. Whereas when we were kids, the second you didn't follow direction the first time asked, it was on. We knew the consequences. Did your parents have to beat you when you were kids to know that that was the consequence? No, because there was rumor that you had other siblings that didn't live through those consequences, right? Like, no, I think there was 7 of us. Really? Well, it's just you and I? Yeah, the other 5 didn't make it. We need to go to bed, right? But what's the word that I'm using? Predictability. It's just a predictable understanding. What does your body want as professionals and parents in here? Predictability. You need to go to bed the same time every night. You need to get the same amount of hours of sleep every single day. You can always do more, but we don't want you to do less. You need to eat a school of salmon every single day to get the amount of vitamin E and or omega-3 and all the fine nutrients that you need to feel healthy. But that's not what people want to do. So consequences we'll come back to, because that's where we have to evaluate what's effective and what's not effective. So we have Buzz's Brain and Behavioral Health suggests coping skills to teach students to function differently. So A plus B equals C. Antecedent, behavior, consequence. What happened first, how that influenced the behavior, what is the contingent outcome to that, or the ultimate outcome. So what I have built in is this idea right here, which is called the coping skill. And I spend my entire life teaching these to pro football teams, trying to get signals to the huddle, clearer. I'll be with Shawnee's high school team tonight. We're just crushing it this season. I mean, the team's on fire, but we have great communication. The coaches tell the players what they want them to do versus what they're doing wrong and what not to do. How about that? How about that for starters? If I'm training you to learn a skill and I say, don't do that. Oh, that's not the right way. Oh, no, your elbows are too low. Now they're too high. Oh, what do you want me to do? I say, I need your elbows here, and you're going to leave them there for 1 minute, and I'm going to hold a clock and go. And they leave them there. And then all of a sudden they start dropping their elbows, and I say, I need you to bring them up 3 inches and leave them there again. Great, that's where I need them. I'm reinforcing what needs to be done. That's the key. So when we're building coping skills, everyone in here has to start thinking, whatever that tool is, the communication has to be about, what do you want the person to achieve? How do you want them to get it done? We don't want to say no, don't, or stop. We want to say, keep going, keep doing this, make sure you continue. In this moment, I need you to. So this girl that I was with this morning who has seizure disorder, we have taught her how to breathe when she feels stress. It's amazing because when I started with her 2 years ago, anytime that she had to go to the bathroom, the school had her using a popsicle stick to hold up. That meant I have to go to the bathroom. Meanwhile, she's verbal. So I said, well, there's only 5 popsicle sticks. What if she has to go more than 5? And they said, well, 5's the limit. All right, well, let's say she has 7. Well, then we give her more popsicle sticks. And I said, well, why wouldn't you just give her a bucket of popsicle sticks then, knowing that there really isn't a limit on this? There's no boundary. So meanwhile, we taught her to say, which was very easy, it happened in an hour, I really have to go to the bathroom right now. But I would only allow her to do it if she raised her hand. So she became a hand raiser. But it's interesting, in that class, everyone became a hand raiser because that became the expectation. But here was the key. The only way I was able to get that to work for all the students in the class, even though I was only there for her, was to make sure that teachers were not calling on kids when their hands were down. There was a lot of reinforcement of negative behavior, which includes not meeting expectations because the teachers were impulsive and they were not able to delay gratification. So they were reinforcing kids' behavior by calling them when their hands were down. But then they would make them feel guilty by saying, hey, you want to answer that question, you can't be sitting there just calling out. No. What do you want them to do? Well, you need to raise your hand. So you need to raise your hand. But you shouldn't even talk to that child until he does what first? Raises his hand. It's positive reinforcement because even though you're not reinforcing the hand raising, we're giving the child unnecessary attention, which really might be the function behind the behavior. So as adults, we do things like this. I say to my class, what kind of triangle is this? And Susie yells out, that's an isosceles triangle. Very good, Susie. And what kind of triangle is this? And Johnny yells out, how many more of these are we going to be doing? And I said, you know what, sir? You need to raise your hand. Well, she didn't raise her hand. But see, I'm valuing whether you raise your hand or not depending on the qualitative value of what you're offering to the class. But that's not the expectation. I'm trying to create my child to be a hand raiser. How do we get them to raise hands? Give them the attention when they deserve it because they meet the expectation. So when you're looking at, the A, B, and C here, we teach students them the function of their behavior. Key number 1, teach them the function of their behavior. I have 2 kids with bone disease in my center. So we have them in a group of kids and they're doing push-ups. But they're not allowed to do push-ups because their wrists can break, their shoulders will come out. If you pull on their hand, it'll extend out to here. And they both have this disorder. We have multiple people with the disorder, but this happened to be siblings. So my instructor says, hey, give me 25 push-ups. And you'll see these 2 beautiful kids, ages 6th grade, 7th grade, brother, sister. They'll raise their hand. And then I'll jump in. Well, what do you need? Thank you for raising your hand, but what do you need? And I'm doing this, but antecedent manipulation. I'm trying to hijack them emotionally because not everyone's going to be nice to them when they don't follow expectations. So we're training them to be durable and to endure criticism and all kinds of rough content because they look perfect. But are they perfect? No, they're fragile. Skeletally, they're fragile. And then the boy says to me, well, sir, a word that we taught him to say because we only give them attention when they use the word sir. My sister and I are not allowed to do push-ups. Why? What are you, oppositional? No, we have a rare bone disease, and unfortunately, we'll suffer negative consequences. Notice the language if we do push-ups because our bones are too fragile. Well, you look fine to me. This is all staged. And the kid says, we look fine, but I can explain my disorder better to you if you give me a few minutes. You know what, sir? I trust you. All right, so what are you going to do in place of it? Well, we can do 25 crunches. Then that's what I'm going to ask you to do. Because what is the goal in that moment? To exercise. It's not a push-up camp. You're not going to be a push-up champion, but we want them to be part of the process. So we come up with ways to teach them their function. So when a kid's running down the hallway, so you're running because, are you running late to class? Yes. What happens when you see a kid running down the hallway and we say, hey, there's no running in here? And then you get this emotionally driven kid that says, I wasn't running, I'm jogging. All right, so now are we going to pull out a stopwatch and see how fast is running versus how fast is jogging? Because you could get into a debate all year long with this kid about it. This is very common. Ready? No, you look like you're running. Well, you need to get your eyes checked because obviously you don't know that 4 miles an hour jogging, 4 miles an hour is jogging, and 7 miles an hour is running. I was clearly doing no more than 4 miles an hour. You know what, sir? I'm done with your attitude. Well, you started your disrespect with me. I mean, just to be honest with you. You're like, what is your name? Well, sir, what is your name? So we could go back and forth. I mean, you're not even like a real teacher. Aren't you like a substitute teacher or something here? So now he's going to go for the juggler. Because it's not about walking in hallway. It's about who's going to win. It's all about who's going to win. It's control. When in reality, if I just said to him, excuse me, sir, I just want to remind you that when we're in the hallways here, we walk. We want to train him to be a hallway walker. That's all we want. We want order. That's all we want. So when you think about teaching him the function behind him running was, I'm running late for class, which is why I'm running. All right, so if you're late, go to the main office because that's right near you. Let them know you're on your way and we'll get you a pass. Why were you late? I can't get my locker open. What's the precursor to the issue here? The locker. If he got his locker open on time, he would have been walking because he would have been on time. So what's the problem with opening the locker? Can't sequence it. He doesn't have the coordination. He keeps forgetting. He doesn't have his password, whatever it might be. But that investigation all the way back here allows us to teach the function. Everything I'm telling you, so we put on his binder somewhere on the inside, his combination. He leaves the first class 2 minutes early before everyone else leaves so we can get to his locker that's on the other side of the school so he has enough time to be able to make it to his next class. These are all coping strategies. If we want to reinforce anything, what are we going to reinforce? The fact that he knows how to ask for help and use independent strategies to meet the goals of the institution. The problem with reinforcement is, should we be giving him gummy bears for all this? The answer is no. No. Johnny walks in every day, whacks somebody in the head when he goes to his chair. Today, he doesn't touch anybody. Am I going to give him a gummy bear because he didn't touch anybody? Not supposed to touch anybody. Not supposed to touch anybody. That's the expectation. I'm not going to reward you for meeting. You didn't shoot anybody today. Oh, I'm going to take you out to Cheesecake Factory. Let's go. I mean, this is wonderful. We should all celebrate. You're not supposed to shoot people. You're not supposed to name call. So we want to contingently reinforce verbal how great it was, the cause and effect relationship, cause and effect of the behavioral choice that the child used. And over a period of time, we can structurally reinforce the fact they've been using coping skills to be able to handle whatever the antecedent is that's been causing the problem. Forgetfulness, stress, anxiety, awkwardness. Does everyone follow this? This coping mechanism is what's missing in our system of care. It's just missing. When I leave here in a little while, I will put people's lives at risk by speeding in my car all the way to my next destination. And that's sad. But you know why I do it? Not because I love to drive fast. I do it because I don't pay attention. Neither do you guys. But if you had a satellite in the air that every time you went over the speed limit by 3 miles an hour and it fired a ticket to your email, and if you didn't pay it in 48 hours, you go to jail, none of you would speed. But we don't pay attention to that because there's no consistent consequence to when we speed. That's just the way it works. So what we want to do is give constant attention to the kids when they're trying to use our coping mechanisms so we can make them feel special, feel great, feel achieved. We don't have to deliver more things, a bigger cell phone or a greater case or now a charger that attaches to the back and all kinds of things like that. We want to make this right here celebratory. Before any questions or anything, let's do. So we have the coping skill as letter B. Letter C, we hold students accountable when the student knows the coping strategy and has mastered the skill. So you look at number 4, it says, I can't versus I won't. When you go to a professional like Buzz, that's why you're paying the big money. I tell people all the time, I get paid for 2 things, to be brutally, outrageously, obnoxiously honest. Anyone that knows me knows it is right between your eyes, whether your kid's going to kill himself or he needs to go to Utah into a program. I get paid to be truthful. And the next one is, I got to be accurate. So if you're paying somebody to help you with your situation, they better be both of those things. So when we are trying to access help, what someone needs to tell you is that they can't or they won't do it. That information saves marriages. It saves lives. Because if he can't, we got to teach him. If he won't, it's on. We're going strong. I'm done messing around, sir. And we see them with their fits and dun-dun-dun, I'll call DCPNP on you. Okay, yeah, listen, I hear you. And we ride that out because he has not deserved the right to be in my house until he takes those shoes off. It's okay to call people. I always say police are interventions. They're interventionists. They don't even punish you. They can bring you to a court to decide whether you're punishable or not. I mean, they're just a vehicle. They're conduit. So when you think about our lives, the measurement of I can't versus I won't is a brilliant concept. We're just not always accurate with it. And that's where some of us feel guilty because we find our kids are disabled. We're like, oh, man, I've been hammering away at him, and meanwhile, he couldn't help it. And it's hurtful, right? It really, really jacks us up. So we look to see if the child is able to be skilled. Because if he's choosing not to perform or achieve the task, he deserves consequences. What is the greatest consequence in the year 2019? I'm going to tell you exactly what it is. Delaying whatever it is that he wants. The delay is the most powerful tool that a parent could have. The fact that he has to stare at his phone, stare at the TV, stare at the computer, stare outside, stare at whatever before he can access it means everything. Everything. So my son, and I'm very embarrassed to say, but was with a couple boys and they threw an egg at somebody's house in their neighborhood. And there's a couple girls there and it was all over like being cute. So when I heard this, I blew a gasket because my son knows better. It's real simple. He doesn't have an egg throwing issue. He doesn't have a diagnosable, trick arm that only happens with non-hard-boiled eggs, right? And the egg came from my house. Oh, man, it was so on that day. I kept telling myself, don't drive more than 50 miles an hour. Just like breathe. I kept thinking, if this was my dad and I was 16, oh, man, like people would be packing their stuff and just leaving town, never coming back. So I called all the parents. No, I made my son call all the parents of the kids who were there. And my son didn't throw the egg, but it doesn't matter. You're part of the group. So meanwhile, we provided the bullets to the gun. We had the egg, came from my house. And the parents were all calling me. Really? Do we need to come to your house tonight? I mean, he threw an egg at the house. I said, are you serious? Absolutely. So I have these moms. Not one dad showed up. I said, where are your husbands? Oh, he's tired. He drives far. Drives far? I travel to California one day a week. I drive to Manhattan a second day a week. I drive to Cape May the third day a week. I drive to Baskin Ridge the fourth day a week. My fifth day, I hope I don't have to leave town or the state on my fifth day. Tired? It's your kid. It's our investment. We had children because we want to take care of them, make them independent people to pay taxes, right? So what we want. So I said, it's unacceptable. Well, Buzz, ready? Aren't kids going to be kids? Our kids broke the law and violated somebody's house. And these are my exact words. And my son is going to take an ass kicking when you all leave for not having a egg-throwing disability because he knows better. So he got upset, and the other parents were like, oh, you need to calm down. I said, listen, I run my house the way I do. He knows better. He volunteered to pay to have it cleaned. He said, why don't we go over to that house and apologize to them? I said, yeah. So don't you know I have all the kids going over there, but the parents were reluctant to go to apologize for their own children's behavior. It's unacceptable. So the child recommended they apologize first, which I'm with it. But the parents should be apologizing also. Because let me just tell you, when you hear the testimony of the family, it was at night. They have 2 little children. The alarm went off. The dog is barking, and they thought someone broke in. Are we not responsible for our children? Were they raised by wolves? Come on. My child is a product of my home. I take full responsibility. Now, if he's going to go to jail, he's going to jail. I'm not. But I'm responsible for him. And I had to do better. Yeah. And this is your own value system. Listen, there's no right or wrong.
And I'm curious, because I'm 52. Is this an age difference of generational?
It very well could be. It absolutely could be. Yeah. Yeah, listen, and we don't condone certain things either. So kids can act certain ways because they have problems or issues, but we are absolutely responsible for bringing them up to be decent people. So when I have not taught them that, I owe the respect to the family to say, I just want to let you know how sorry I am that this kind of behavior, because I didn't train them this way, number one. But the fact that the family was traumatized with little kids in the house is wrong. Here's the key. Is he was 15 at the time, 15-year-old kid who has no frontal lobes with underdeveloped cognition, even understanding what the consequences felt like to that family? The answer is no. But when I had to sit with him after he's watched me go up and say to them, I'm sorry, and hug the mother, and I said, you didn't deserve this, he felt bad that I went up and did that, and he was like, Dad, I'm really sorry. I said, well, that's where you're going to contribute to the fee of getting this window. Luckily, it had a window, and nothing broke. But if it went on the siding of their house, what do eggs do to the paint? So now it's vandalism, right? Now we're in bad territory. This is not good. Yeah. Yes. Such a great. Well, we don't really have much of a choice at 18, right? Yeah. No, it's such a great point. There's really not a quantitative value to that. That's a tough call. And each kid is qualitatively different. And it also determines on your set of circumstances. You know, when I'm in Brooklyn, or I was just in Queens yesterday, and I'm in some areas that are maybe not as groomed or polished as maybe some other areas where, like in Atlantic City, there was a school there last year that not one in the entire elementary school, there was not one kid in the entire elementary school that had both biological parents living in the same house. So when I hear things like that, I'm not making excuses for it, but we all know dads build confidence in their kids and moms build self-esteem. And if they're missing one of those ingredients, or sometimes both, I know that the kid could be set up for failure. Now, I'm not saying the parents or the people who are caring for them are reckless and uncaring, but I don't usually put an age to it. I really put the skill set is really based on this, which is why I held myself accountable, because I was embarrassed. And I think that the parents should have known, you don't have to feel unsafe in our neighborhood knowing that at least my son's going to do this again because I'm on this. And this is a direct reflection of me. Now, when I was a kid, my parents would have beat me in front of those parents and said, I can assure you now that this will never happen again, because that's just the way it kind of went down back then in the old school days. But I have to say that depending on the norms of your society also dictate what those expectations are. So I'm in Laguna at Starbucks at 7 in the morning. That's in California. And while I'm there's only 3 people at a Starbucks at 7 in the morning. Exactly. Exactly. Why? Why did you give me that look like? Why?
7 o'clock in the morning here, you're in the
Yes. Yes. I thought it was closed. I walked in. I said, are they out of business? Like, what's going on? And I see a lady staring at a painting on the wall. She was so content. And I looked over like, did you paint that? Like, how do you look at that for 5 minutes? Like, how is that so exciting to you? Then I see a guy reading a book. And I said, do you have a job or anything? Like, how do you read a book at Starbucks? The only thing I can think of is I need to get fueled up so I'm like an animal. That's the only thing. And I only like the taste of coffee. But I also think I deserve a $5 cup of coffee every morning. So after 5 minutes, I went up to the barista and I was like, hey, barista guy, listen, sir, I need my coffee. He's like, oh, you're very impatient. I was like, so here I am walking back and forth. Cortisol's up, blood rushing to my feet. I can't stand still. So I'm like, listen, like 5 minutes ago, I asked you if I had coffee. There's like 3 of us. I mean, one's coming in here to stare at your paintwork. I mean, it's like, I don't even know. This guy comes in to read a novel. I think I'm all by myself. You don't even have a drive-through. And he says, you really need to take a deep breath. I said, if you were in Jersey, this place would be on fire right now. Right? So I said, and he says to his buddy, did you hear the way he said that? Jersey. I said, what is that supposed to mean? He says, well, you didn't say New Jersey. You said Jersey. I said, I know, Jersey Shore, Sopranos. That's the cultural idea that they had, is we're these aggressive people. So quickly they're trying to get my coffee like, hey, he's probably armed. You know, like, Right, coming in. I did everything but start swinging, right? Because in New Jersey, we dictate our behavior that way. People touch. People are in each other's face. Or if I'm on the phone, some guy goes to ask me a question. Oh, sir, you don't see him on the phone? If I'm in California, they pretend they don't see you. Ooh, I'm going to go over here. I'm thinking, why are you ducking me? Let's just be truthful. So those cultural norms. So here's my point. Every house has its own culture. Yeah, and it's hard to, so because of that, if your husband's ex-military, like your lights might be out at 9 o'clock. If you're a laid-back family and you moved from California, everyone's kind of watching whatever, the Kardashian episodes at 11 o'clock at night. I mean, I don't know. So I think what we want to do is build the arsenal with them so we can say the measurement is really about skill. Because there are little kids who just know better compared to some teenage kids who take those chances. Let's just do the last one. So coping skills are developed. So strategic skills for coping are taught. The skills are specific to the child. So you have to think, what do you want your child to gain the most? I tell everybody, what's wrong? How do you feel? What do you need? Those are the three big ones. Various tools can be created for children to achieve the same goal. Everyone might do it a little bit differently. And I got to tell you, I see Denver when I see you, I always give you a hug. Not everyone wants to be hugged. I always have to remind myself of that, right? I mean,
Yeah, you're one of my exceptions.
right. But we hug because I came from a hugging family.
I know.
But then I see people and I go like this and they're like looking at me like, oh, here he comes. And they just don't feel, I have to remind myself just based on the value of that type of attention. So when we look at accountability, it really is based on those tools. So if you're going to a counselor, psychologist, LCSW, LPC, therapist, you want that, is it discipline or disability? And number two is, how do we teach the skills? These people that come to the house and they're just taking your kid for a walk every day blows my mind. Like we have to go to, I went to college for 25 years. 25 years. 25 stinking years. Up until 2017. I can't imagine going to someone's house and just taking them for a walk. I cannot imagine building a crisis plan to every single house of every single person I work with. I can't imagine not training the parents like I would train my staff on the procedures of that crisis plan. I can't imagine not spending numerous hours teaching them the system of care in the event that there was a crisis and the plan wasn't working. I can't imagine not building an infrastructure of sleep, diet, and exercise in that house. I can't imagine teaching the parents on how to tell the kids what to do versus what not to do. I can't imagine having a family not having perfect contingent reinforcers of celebrating kids' success without giving them anything. I can't imagine not having something in place to randomly excite the kid with something tangible so he feels like he hit the lottery. I just can't imagine not having every family, anyone that comes to my place, they know these tools because that's what we build, but I can't imagine not having every family that I work with being taught how the importance of having dinner at least one night a week as a family where no one can complain about anything. I can't imagine my own children on a Sunday thinking they have plans to do anything other than eat for 8 straight hours. They just would never ask me. It's built into the model. That's the way it works. I can't imagine having enough time with any client on the planet, just having enough time until they become married, fully employed with their own children, and still not having skills to work on. So when I see somebody who's walking with a kid and they're just talking about it, it almost aggravates me because there's just so much to work on with every child in the world. And if they're doing great in school, think about the advanced executive skills we could teach them using Google Calendar, Google Sheets, Google Docs, or how to use advanced thinking mechanisms about long-term planning by backward design. I mean, think how to use what's called to use outlining techniques that are advanced so they can actually write a set of paragraphs. They can write brilliant, content of stories or papers or thesis statements and things of that nature. I can't imagine even having enough time to do all that. So when we're working with our kids, this stuff here is everything. This is what we want. And we don't want to be held hostage with the kids not having this, and then we're just consequencing the heck out of them. It's all not contingent reinforcement. It's got to be skill. Questions on anything? Yes, anything.
So where I struggle is somewhere in between can't and won't. So
getting to school in the morning?
Yes.
Does my son not get enough sleep because his bus comes at 6:45? Absolutely. Is the system set up so high school kids don't get enough sleep? Yeah, right. Can he get up? And I said I'll be your basketball coach if you make the bus every day. He did. But
So we can.
it legit he can, but it really isn't easy. He really is tired.
Yeah.
I struggle with it. I'm not gonna lie.
Right.
So we're in it like grade.
How old is he?
14.
Okay.
He can, but it's really hard.
Right. And we know 14-year-olders, ready? Pubescent kids struggle with sleep big time because their GABA levels are commonly low. Serotonin levels are challenged. If you don't produce GABA in your gut, then you won't, that's the precursor for serotonin. If you don't produce serotonin, then you don't produce melatonin. So now someone's not sleeping, and let's say they're not sleeping, it's making them anxious. When you're anxious and you don't sleep and you go to a doctor, what do they prescribe? Prozac, because you meet the criteria of anxiety disorder and OS. Whereas I say, let's do labs, let's look at it, and we find with teenagers, GABA levels are almost always low. Sometimes the serotonin's fine, but you can't produce melatonin without both. So we give them a GABA supplement. Sometimes it's magnesium. Magnesium's everyone in this room should be taking minimum 800 milligrams of magnesium a day. Everybody. Because all of us have, 80% of all Americans are low on magnesium. So anytime you take more supplement than you need, you excrete it at the end of your day. So you don't have to worry about anything harmful happening. But magnesium is a driver for kids for sleep. So he might be sleeping, but not getting sleep replenishment.
By the way, a doctor years ago wanted to give him Prozac, and he had pharmacogenetic.
I'll see you. Thanks, Seth.
Be a good idea, and I said no, and we did therapy instead because he's like really getting anxious about.
Right, right.
So I'm with you on that, and we do melatonin, but it's just the problem is, as everyone here knows, like consequences, like when you
Thank
get
you.
out the door, you're gonna get out the door. Like
Right.
Like positive reinforcement, everything, like that's not it. Like.
So the behavior mod is fine, but let's just pretend the precursor to that. This is a great example because I do this the most because sleep is my #1 driver. So the first thing we would be targeting even before your child's behavior is a behavior mod a little bit of just rewarding him. So reinforcement rather, not reward, for just getting out the door, reinforcement. So he'll have access to things just by getting out the door. But when we go back to the precursor, we got to make sure he's sleeping soundly. That has to happen. If he's tired in the morning and early, 6:45, I could show you the research. It shows that kids his age are not even fully through their last round of REM sleep at 6:45 in the morning. There's proof of that. Yeah. Yeah, that's fine. Listen, that's a coping skill. That's nothing wrong with that.
7 o'clock will drive, and it's 7:05, then it's 7:10. I don't have, he doesn't get his Xbox unless he makes it, but he hasn't done that and doesn't care. Like I run out of those constantly.
Right. Understood.
Cotton candy one morning, and I was asking him, maybe this would be like,
Wow.
yeah.
Dan, that was like you and I having a beer in the morning, right? It'll be like,
Right?
yeah, again. We really would want to investigate his sleep. Remember I started off, the investigation, when you go to somebody, help me understand the difference between discipline and disability. You don't want to be hammering away at this stuff if there's a precursor that's not allowing your child to be able to do certain things. We got to know that. In the meantime, he's still got to be held accountable. So what we're saying to you is, hey, we're going to suspend things until he can get out the door. Now he can get out, he's pulling his pants up, right? He's got a sandwich in his mouth. That's fine, he's half disheveled. But the key here is he's not being fully rewarded with all kinds of tangible stuff, with all kinds of tangible things that would reinforce the fact that he's running late and his pants are half down. We want to make it a suspension of the things that are high interest to him. Does everyone follow that? That's called a logical negative consequence. Let me give you the definition. I get mad and I break my iPad. What's the natural consequence? It's broken. What's the logical consequence the parent says to the child now with that iPad? You want to get another one? You're going to have to work around the house to earn money to be able to buy the next one yourself. And I've been through that with my own kids and they're going out at phone, going insane. I'm saying, I'm glad you're going insane with me in the house because this is what I do for a living. So go insane, I'll put you in a hospital, but you're not getting it because you haven't deserved it. You haven't raised the money. All right, fine, I'll dig dirt, I'll cut weeds or whatever. Okay, and that's where we have to compel them with this to move forward. Yes?
So I've noticed that we're that a lot of
Oh, Thank you.
So sorry.
Yes, take your time.
And so we're trying to find that proper medication for our youth. And so we tried to do the
Gen Ed. Yeah.
and nobody wants to pay for it. So is there any kind of testing that we could get the doctors to do?
So that's such a great question. So the genetic testing, so like in our center in Manhattan with the Amen Clinic, it's the standard of care. Anyone that walks in gets the testing. It's just built into what we do.
I would love to go there and send all my kids there.
Right, but it's money, right? It's money. It's so we do neuro labs, like I do them out of my center, but they're $500. So you're almost better off paying the $300 to get the genetic testing. However, what the testing tells you is what's going to work adversely, versus what's going to cooperate. That's for medicine. The target should never be medicine right off the top. So when we do neuro labs, it's telling us where the actual chemicals are pre-blood barrier. So I was on the phone yesterday with a pediatrician who was beating me up.
They do say like your folic acid is low or what is metabolizing in your blood system. So you can get some of that and like one of my youth had a vitamin C deficiency. They were able to distinguish that from the testing.
That's why not knowing the right medicine is not important. We need those numbers. We need those numbers.
They get a whole paperwork that says the red, the green, and then my son did it, but there's different ones. Yeah, Dr. Ned around here does a different one than
Yeah, we want GABA, serotonin, dopamine, cortisol levels. That's right off the bat. If you get GABA, serotonin, dopamine, those are all of your emotional intelligence chemicals, right? And it also includes sleep. And then your cortisol is going to be your flight reaction and your fight reaction. You know how many people I work with? I can tell you right now, if I tested some of you in here, you're not sleeping well because your cortisol levels are too high. Why? Because you're doing 8 loads of laundry a day and you're just tired and then your mind's racing. So you lay in bed and you're already worrying about tomorrow, tonight, and then you stare at your phone, you're looking at the clock. I mean, your husband's looking at you cockeyed like, I could use something from you right now. And you're thinking, I don't even know why I married you. You're like, because you're so torqued up. And it's not a love thing. It's how your body handles stress. Just reducing cortisol, which is a number 2 target of mine. So sleep is 1, 2 is cortisol. So I'm going to tell you your cortisol droppers. 1 is green tea, warm green decaffeinated tea. Love it. Just had my son do it last night. He was feeling all ramped up. I said, take a shower. Shower is the second thing. Showers, hot showers, droppers, cortisol. The next one is sex. Just saying.
Not recommending that to my 14-year-old.
No. But guys get a bad rap. They fall asleep. I get it, but your cortisol drops and it makes you tired. I'm just being truthful about how anatomy works. For children, let's use number 4, right? Could replace with children as number 3. Would be what we call havening, which we teach in my center. I can give you a website you can actually, or not a website. I'll give you a YouTube video you can watch with a colleague. There's a guy named Paul McKenna, capital MC, capital Kenna. Paul McKenna. He has a video says havening techniques. So we use havening. So we did it with a lot of the pro teams in the basketball in the playoffs last year. You'll see guys on the sideline havening. You would see guys at the free throw line havening to get their serotonin and GABA levels and their dopamine levels up. Because if your levels are down based on stress, what happens to your cortisol levels? They go up. And when you have high levels of cortisol, what happens to your prefrontal function, which controls your motor coordination? It plummets. So you'll see the guy. So the next one is breathing, right? So slow breathing. So a lot of people put breathing as number 1. And I always say, get the decaffeinated tea in you, take the shower, haven while you breathe, and you're in really good shape. I have a couple attorneys who are in really, really bad shape that I was treating, and I told them, you have to have sex with your wife every single night. Every single night. He says, but what if you just don't want to do that? And I said, then you're not going to sleep. And it's true because they need these cortisol droppers. And, some people are just anti-treatment, so you need other ways of getting it done. So a couple of guys were lifting, but they were lifting without breathing. Now their cortisol levels are all the way through the roof. It's worse. If you're doing something conditioning, even light dumbbells, 3 seconds in, 6 seconds out, you're breathing out through your mouth. has to be double the amount of air you take in through your nose. The reason why you take it in through your nose, it humidifies the air to get in your chest quicker. Most people don't know that. So when you're breathing slower, helps bring cortisol down. What does every pro basketball player do as the last thing before they shoot a foul shot? Take a deep breath. And it's not a coincidence, right? So right here, watch. When they did that, cortisol dropped, your frontal lobes pop up, and you have motor coordination. What does Tom Brady do so well? He's got great breathing skills. That's why he never seems like he stresses. And his coach, who I know very, very well, Bill Belichick, I wouldn't say he's necessarily the best breather, but he's a guy who just doesn't get emotional. So when you have an unemotional coach with an unemotional quarterback, you create an emotionally intelligent team. Now the other team's getting emotional, and what is their cortisol levels doing? Flying off the charts. So now they're getting penalties. They're burning out. They're tired. They're making mistakes. They're arguing with each other. And then you got the other team like this waiting. Like, look at these guys. They're all falling apart. So when you think about our houses, that's why I'm saying when we're working with families, building all those things versus going for nice long walks has to happen. We got to build those houses to have all these tools. So when a kid is having a panic attack, he's not, and we're not saying to him, just calm down, just calm down. We know how that works. It makes the kid worse, right? Versus right now, you need to follow my breathing pattern that we've practiced, and we do it together. And listen, we're going to haven with that. We're going to get our serotonin levels up. Let's walk while we're doing it because blood is rushing through our legs. And then let's tire ourselves out a little bit. Mom, make some green decaffeinated tea. And then we're walking. The kid has an action plan. So now he's learning how to do this. So I had an attorney, Dan, who I taught how to haven. And he's autistic, this attorney. And he has an autistic wife. And they're both so autistic that they don't even know they're autistic. So, and I've been trying to talk to him about his autism because it throws him off in court a lot. Because when things are not going exactly as planned, he gets derailed. So I taught him how to do this havening. So right in the middle of this court thing, he's going, Your Honor, I think it's disingenuous that the adversary would, and the judge looking at him like, what the hell are you doing? And he's looking at me, and I was like, oh, no, you don't want to do that now. And he's looking at me like, but you taught me this. So he's like, so what I wanted to tell you, Your Honor, is, but it worked. He got right back on board. It saved him in the moment. So he says, were you proud of me? I was like, yeah, like, we got to come back to that. And he was like, but you told me to do that. And I was like, I know, I just didn't think about not telling you to do it that way in court. Like, you could have been, use your hands or something, right? So I just want to throw one last thing that has to do with that. We looked at all the studies recently with my team. Where, my partners are all neuroscientists. So we looked at all the studies, and we found this insane discrepancy between children who are born natural birth versus C-section. And there is a significant discrepancy between the two. And we've learned to a significant degree, I would give you the number, but I forget it right now, but of the kids who are born C-section are primarily much more anxious than kids who are born vaginal birth. Very much prone to anxiety. So it's because of the natural delivery. Number two is you get a replenishment of delta waves when you come out of the canal. And lastly, people who are touched and stroked upon birth in the first 30 seconds, 3 minutes, 5 minutes, whatever that time is, actually have the highest levels of serotonin, GABA, and dopamine in their early development. So it's wild, right? Which is why people. Yes, 100%. And we're seeing, so that's absolutely true. Inflammatory cytochromes is another that ties into that. There's just a lot of research showing. But we see this that, Asian countries, a lot of C-sections, we're seeing that just, more anxiety, more emotional differences. So if your child has those tools and they're getting anxious, we would say, what did I tell you to do? So that last piece for everybody is, if you properly skilled your child, client, student, whoever, you should be able to prompt them on the tool and they activate the plan. Like, what do we do when the fire alarm goes off? The kids all line up, being prepared. What should every therapist, counselor, clinician be doing for our kids when we're accessing help? teaching them the tools. That just doesn't happen often enough. And psychiatrists are the ones who went to medical school, and there's all these medical things that we can do, like havening, psychosensory tools. I can keep going. And that's just not the way the standard of care works at all. So, yes. Yes. It's amazing. There's a chance? We might be able to help you? Are you on the road? Don't watch it when you're on the road. I got to tell you a funny thing with that. I'm in Manhattan. Yeah, right. Get somebody behind you, right? I was in Manhattan. I was crossing Broadway, and I was really stressed out. This is like 6 months. It was over the summer. So I was like, you know what? It's a long light because Broadway's busy. And I started havening. Next thing I wake up to somebody. Here I'd fallen asleep. What do we know about good sleeping? High levels of serotonin, dopamine, and GABA. When you raise them, right, you sleep like a champ, which is why when they hear anxious, not sleeping, Prozac, right? Let's go number 2. When you have a little baby and you're holding them and they're not sleeping, what do we do? And what does that do? Raises their serotonin, GABA, and dopamine levels and you sleep. Puts them out. Yes, and you see their eyes. And then we watch them like, God, I could sleep with them. Like, right? It's amazing, right?
Actually, well, to your point, I have, when my asthma gets bad a couple times a year, like right now, I go on Advair, which is, it's cortisol, well, it's steroids, and it's like all kinds of albuterol. And I'm like Michael Douglas from Falling Down for like a week.
How about that? Yes. Yes, 100%. We have a kid in my center. I had people in there a couple weeks ago watching, looking at the center. We're just observing, we're training them. And I said, watch this kid when he comes in. We're going to manipulate the situation to put stress on him to see if he's gained the tools. When he started with us over a year ago, he was throwing things. And he was chair throwing in a school. They didn't know what to do with him in this public school. He's 8 years old. And, we get a lot of those clients because that's what we do. So we had a couple of restraints on him when he first started, and because he was able to use his frontal lobes, knowing predictably, if I act this way, they're probably going to have to restrain me. Our restraints, he's not getting taken down like an MMA fight. We're navigating him to safety. It's done. We're all positive communication, setting positive boundaries, but he didn't like to be touched. So I taught him the havening, taught him breathing, and so I said to my crew, when he comes in today, let's have his sister not be able to do his group with him, and let's see what happens, because he loves having his sister there. And I knew that was going to be a trigger. This is a great story. So one of the first expectations after we teach them what's wrong, how do you feel, what do you need, is you're not allowed to leave your spot unless you raise your hand. We want everyone being hand raisers because it teaches you how to delay gratification. So he's on a spot. He says, where's my sister? Well, no one's paying attention to him because you also have to have your hand up. So they're walking back and forth. So then he's like, so someone calls him. Yes, sir. Where is my sister? Oh, I'm sorry. She's not coming in today. What? And he blows a gasket. So let's just walk through the anatomy of that. What's happening to him? The antecedent is what? What? His sister. What's the behavior? He's freaking out. All right, so you ready? In here, what's happening to him neuroanatomically? The coping skills were gone, right? Because his cortisol took off, and where do you find your coping skills? In your prefrontal cortex. So he couldn't access the information that he had been trained. So what he does, though, surprisingly, unlike what we went through when he first started with, the average family drives to my place on a Saturday, an hour and a half is the average drive for an hour to go home. We have multiple families that fly in monthly, and then we have a number of families come 2.5 hours away for years. Oh, Manhattan, Staten Island, Bergen County, Sparta, Newark, Delaware, Northeast Philly, and I give them credit. Well, this is one of those families coming from Lower Cape May. So in my mind, I'm thinking they have to have a safe ride home. But I looked at my lead clinician, looks at me, and he looks at me, and I said, go ahead and do it. So he says, you know what, sir? She's not coming in, okay? Now, we're doing that on purpose. That's not the way we would recommend you guys therapeutically talking to your clients. We want to see how he handles it. He goes off his spot, and he's over here, and he's havening, right? Doing this. So my guy looks at me and says, go ahead. Sir, you need to be on your spot. He says, I'm not going back to my spot. Now he's using his shoulders and his face. and his shoulders. And he's going, and he says, sir, if you are, no, where are you supposed to be right now? He says, sir, I am only going to go back on my spot when I slow my breathing down to 5 seconds in and 5 seconds out. So my instructor, I go, get him again. He says, yeah, but you didn't get permission to leave your spot. He says, don't you see I'm using Buzz's psychosensory technique to calm myself down? But isn't that what we want?
Yes.
Now, we looked, all my instructors and I looked at each other, we were like, oh my God, we were so excited. Now, watch this. When he was leaving, he didn't meet all of our expectations in that hour. Because getting off your spot, you're off the expectations. That one little trip up, you're not getting, the end, you get a black electrical tape on your karate belt, and he's not earning it. Why didn't he earn it that day? He did something that was miraculous, but why didn't he get that stripe? Because when he got in line and learned he wasn't going to get it, he handled it like a champ. He's like, am I getting my stripe? My instructor says what? Why?
He understood that.
He understood
He
it.
accepted it because it was an expectation that was very clear.
And it's predictable. It never changes. So those structured homes reduce stress with our children. And then when they're learning the skills, they're great direction followers the first time asked. And so when he found out he didn't get a stripe, you can see his hands. Why does his hands clench up? Cortisol. What did the blood do? Went to his hands. So when we going to make a big deal about that? No, he's holding together. Now watch. As soon as he walks away from my guy, he goes, he's like, I don't trust myself right now. I got to bring it down. And that's what he did. But that's, yes, and he's been great. We use him as our example. And now he's teaching other kids. So that was my point. So listen, yes, last question.
Not a question.
Oh.
My son Sean is in your program. And
Oh, yeah. Your face, yes. Talk about it, please. Forgot,
he's
Nance.
taking the GABA. He's sleeping. My child never slept. Not in the womb. Not ever.
I can't believe I didn't put it together. I just knew I'd have thought of
Sorry,
it.
but you usually see Sean.
Yeah, but yeah, go ahead. Oh, man.
But yeah, so Sean is...
He came in the beginning. Go to the beginning.
Yeah, so-
Very anxious.
Very anxious. Has always had anxiety. He had school refusal. Would not do anything. Poor eater. Poor sleeper. All of
Yes.
that. And
So we targeted sleep.
sleep was
I
the
said he's
first
got to get to sleep because if he's not sleeping, he's not worth anything.
Right.
And we're going to be arguing with all this stuff. So he was so anxious, I couldn't even get him really into the center.
Didn't even get him into the center.
So I
And now
was using, comes in. What's up, guys? Now he's texting on a thread with us, with the other guys. And then they just did video gaming. He's lifting weights. He's on a weightlifting routine.
he's between you and here. It is a new child.
It's awesome. He's such a cool kid.
He's 16.
Yeah.
He's out of the car here now. He's like, "See you later, Mom." That was never my child. Never.
Didn't he have it one night where I didn't know he was in there and he wouldn't, and then he jumped, I think he bailed out because he didn't see me. And I was like, oh no, where is he? Because he was new.
Know somebody. He has to see somebody that.
So I validated him and slowed him down. And I said, listen, we go around the back of the building, come through another door. Why does he have to go in? Why? Why do I have to make that happen? Think about reinforcement. If he escaped going in my office that night, what happens the next time he just doesn't even want to go? Or he's feeling anxious.
Yeah, it's memorial. You don't want to memorialize that. You want the last memory to be.
Exactly. And I was like, I don't care if I have to be here till 3 a.m. Now, what's really cool about him is he came up with an idea recently, and we were like, ready to throw a party. He says, what if we all went to a movie? And I was like, really? Yeah. I said, well, we could do a movie. Like what? I think it was Joker or something. That he saw the Joker, and he says, yeah, the Joker's really good. Do you think anyone would want to see? I said, why don't you ask? So now he's asking. So he got that idea. So we're looking to do it on Halloween. I'm letting you know now. Yeah, but it's great, right? I mean, but we want him. Sorry. So let me just go to the last thing and then we'll go. So for her guy, our next goal is to get him setting goals for himself. So notice, we're just not happy he's going to school and coming to my place. We just got cooperation. He's surviving now. He's not living in limbic land where he's like, I can't even go in there.
Not, you know,
Like this.
shoulders in, head down, holding his stomach. He doesn't do any of that now.
What we're measuring, which you probably don't, maybe you know, we have him doing the general anxiety disorder, updated checklist. All right, so that's what we're doing. So we have ongoing measurements with him. He's right on point. But now what we want to do is do planning so he can learn how to set long-term goals and break them down to short-term goals to achieve all those goals. So he is he's fantastic. I know. I'm so glad you're here. It's so cool. Listen, thank you for your time. If you guys ever need anything, email me. I mean, it takes me like a day. If you don't hear back from me, you got to hit me on the email again because we get like hundreds in a day, and 90% of them are emergencies. So we don't do any phone call emergencies, or people would be on the phone with us all day and we couldn't work. But they're like serious emergencies. But just hit it again. Just say, hey, I didn't hear back from you. If you need anything at all, I'm pretty resourceful. We can always figure something out to get you what you need. All right? Thanks, guys. Appreciate your time. Yeah, appreciate it. Great group.
Thank you, Dr. Buzz.
Thank you. Great group. Oh, I appreciate it.